Thank you very much. I'm very pleased to be here today. I'm Tabitha Brufal, and I'm one of the Deputy Directors from the Department of Health and Social Care. And I've spent the last couple of months working on a project which is very sort of important to our Secretary of State, Stephen Barclay, and the project focuses on international recruitment. I think our Secretary of State, when he first joined us in the summer back in August, was very struck by the high number of vacancies, both in the NHS, but also in adult social care. And he was keen that we explored the best possible use that could be made of international recruitment. The first thing that I want to say is very obvious, is that sort of international recruitment is not a new thing in the UK. I've shown here a picture of the boat, the Empire Windrush, and staff have been playing, international staff have been playing an absolutely critical role in the health and the care system since 1948. We've obviously had changes to our immigration rules and the visa rules over all that time, and I'm just going to run through next the sort of current position. So Stephen Barclay, he asked us to look at how we could improve the use of international recruitment to fill workforce gaps. Also, very importantly, it matters that we approach this in an ethical way, and that the employment practices are taken forward properly, and that we strengthen safeguards against any international recruit being exploited. And some international recruits are vulnerable when they come to the UK. They could be vulnerable because there are sort of unethical recruitment practices going on in their country of origin, and we have heard tales of organisations charging recruits to find them jobs in England, which is illegal, not necessary, but can lead to international recruits arriving in the UK already with some debts. And it is also important that any recruitment agency that is used by employers in the UK follows ethical practices too. But what we find in August 2020, a new health and care visa was launched, enabling people to come to work in the primarily the NHS, but also into professional roles within the care sector. And this visa made it £2,000 cheaper for health and care workers to secure visas than people looking to work in any other sector. In January 2021, a new immigration system was launched, and senior care workers at this time were made part of the shortage occupation list. So that enabled senior care workers to come into the country. And the salary threshold that was required for someone to receive a visa, it was brought down to £20,480, and this is significantly less than the salary requirement for any other person sort of coming into the country to work in a shortage occupation. In February of this year, care workers were added to the shortage occupation list. There's been a significant engagement with the sector through Skills for Care and through other representative bodies to encourage employers to consider the sort of pros and cons for them of engaging in international recruitment. I do know that the salary threshold, although it's been reduced at £20,480, can be a bit higher than providers might be paying their workforce. But for many providers, and we're seeing this in the data that's coming through, they are making use of this route. kind of recognising that there are some sort of challenges for providers in using this employment route. Therese Coffey, when she was Secretary of State in September, announced that we would be launching a £15 million fund to support providers across the country with international recruitment. And I'll say a little bit more about that shortly. So in terms of international recruitment in the sector, Skills for Care recently published a report looking at different employment routes into the sector. Skills for Care was that 10 to 15,000 care workers had actually been recruited internationally so far this year. So what that shows is that although this is not perhaps the simplest procedure to go through, it is actually possible. And I think sort of many providers who have started to use this route, once they get familiar with it, find it a very useful way of filling their vacancies. And what the report also showed, that of new recruits coming into the care sector who haven't worked in the sector previously, some 11% now are coming from overseas, and that builds on sort of 4% in 2021, 2% in 2020. So it is a growing route. We also see that there are certain benefits for international recruitment. Of the staff that do join the sector this way, provided that providers think about how to welcome them into the sector and provide them with training and the skills that they need, the retention tends to be much higher than it is for domestic recruits. The staff can be very loyal to their employer and committed. International recruits often come with many transferable skills and may have worked at quite a high level in the health and care sector in their own country, but may initially experience some sort of language barriers when they come here, which makes them happy to take more sort of junior roles in the care sector. We also think there are opportunities for providers to think planning and what training they may give international recruits as well as their domestic recruits to help them progress into more senior roles in the care system, but also over time perhaps in the NHS. This map here shows that employers have to go through to be able to recruit internationally. The first step, we say, is preparation, and it is important for employers to consider whether international recruitment is something that makes sense in their particular context. As we'll go on to say, it's not entirely straightforward, and where it's successful, employers do really think about what the international recruits need. To be able to recruit internationally, employers have to apply for a sponsorship licence from UK Visas and Immigration. We recognise that the guidance provided by the Home Office can look quite challenging and quite off-putting, and we are looking to publish very shortly some sort of handy hints to help providers navigate that process. It can take up to 8 weeks to receive that licence, but once an employer has that licence lasts, I can't remember now whether it's for sort of 3 or 4 years, so it's sort of worth that initial pain to be able to draw on this recruitment pool. Employers may then wish to run a recruitment campaign to sort of sift, interview and select candidates. This can be done through a recruitment agency. And there are sort of tens of agencies that have a licence to operate in the UK and are regarded as ethical recruitment agencies. At this stage, the employer must both apply for and assign certificates of sponsorship. So UKVI makes these available in with quite a quick turnaround. It should, in most cases, just take a day or a few days to get those certificates of sponsorship. Once a recruit has been identified and has agreed to come over to the country, the person will apply for their visa, receive their visa, and can come to England. We find that some employers try to do some induction training and some of the welcome training while the recruit is still in their home country. And employers will also give consideration about whether to organise and pay for flights and initial accommodation. Sometimes that is sort of gifted to the recruit. Other times the employer may look to give a loan and to take that money back over the first few months of some. We'll say a little bit more about this later on, but the pastoral support provided by the provider is something that can make or break the placement. And we do find that the sort of employers who recruit successfully and enjoy good retention have really thought through what's needed. There is guidance available on gov.uk. What we have published is a code of practice. It's really important that employers read through this and understand what there are to make sure that they do recruit people ethically. The code of practice I've already mentioned. What this does, the World Health Organization is very that international recruitment needs to take place in accordance with certain principles. And our code applies the WHO code to the UK setting. And it is a code that applies both to public and private health and social care sectors. Within the code of practice, you will find a list of countries where recruiters should not actively recruit unless there is a particular government-to-government agreement. So there are 46 red list countries. The WHO thinks that recruitment should not take place in these countries. The majority are in Africa, but also countries which are perhaps in conflict situations. There are a couple of amber list countries, Kenya and Nepal. Recruitment can take place within those countries, but it's important to proceed carefully. And colleagues working in the department are working with governments. I think particularly at the moment, they're working closely with Sri Lanka and India to make sure that international recruitment proceeds sort of smoothly and effectively for both sides. The ethical recruiters list I've mentioned previously, and this is a list of recruitment agencies that have signed up to operate in accordance with the code of practice. This list is managed by NHS employers and can be found on their site. And we encourage health and care employers to use recruitment organisations that are on this list. If you do that, you can't go far wrong because they are sort of signed up to abiding by these codes of practice. I've talked about the benefits of international recruitment. It is also important to acknowledge that there are some challenges and complexities. Over the summer, the department and also Skills for Care has engaged extensively with providers and their representative bodies and has noticed some of the key barriers. The one that is cited most frequently to us is upfront costs. And the table on the right sets out what these costs typically are. I'll just sort of run through these now because it is important that sort of employers know what it is they'd be letting themselves in for. The which employers must receive from UKVI can cost around £500 through to around £1,500, depending on the size of the employer. There is an immigration skills charge, which needs to be paid per recruit, and UKVI asks for 3 years of payment up front. Again, this will vary according to the size of the employer, but it ranges from around £1,000 for 3 years to £3,000. If the international recruit leaves, it is possible for the employer to recoup this charge. There is a one-off visa fee per recruit. There is a certificate of sponsorship to pay for per recruit. The next cost is voluntary. If an employer chooses to go through an agency, they may charge around £2,500 recruit. And if the employer wishes to meet temporary accommodation charges, that again can come to around £2,500. These costs are high, but employers need to balance these against the costs of otherwise having to perhaps use agency staff, the costs of repeated domestic recruitment, and as I've said before, many employers find that the sort of retention rate and the loyalty for employees coming through this route can typically be higher. There is a bit of administrative burden and complexity associated with this route, but the fact that many employers and more employers are managing to get through it is encouraging. There may well be employers in your area that can offer some advice and support, and we are looking with this sort of £15 million support fund. We are hoping that regions want to set up support arrangements for employers working in their patch. The process can be quite lengthy, so this is something that providers really need to think about in terms of, you know, what are their vacancies going to look like in 2 or 3 months. It's not something that can be used to fill a vacancy sort of within the next week. But I guess you will know what your turnover rate is, and you can think about how this might help you sort of 3 months hence. There can be some pay differentials with domestically recruited staff, depending on pay rates within your particular home or area of the country. We have heard concerns expressed about the ability to retain staff if they may be able to find sort of positions in local NHS employers. We have also heard employers say that they don't feel well equipped to provide pastoral support. In the department and working with Skills for Care, we have been trying to collect up good case practice examples covering all elements of international recruitment, and we're looking to publish these on the Skills for Care website over the next few weeks. The local support fund, which was announced by Therese Coffey, has 3 principal aims. We want to promote close collaborative partnerships between local authorities, between local care alliances and providers, so that the funding is used to provide employers with the support that they need to make a success of international recruitment. There has been a far longer established tradition of international recruitment in the NHS, and it may be that regions want to engage with their local integrated care board and draw on their experience of international recruitment. We want the fund to be used to provide very practical forms of support to providers. So we've talked about the ability to get sort of handy hints and advice about how to navigate the process, but we also think the local support arrangement should be able to advise employers on how to identify accommodation, how to help with induction, how to help recruits with to sort of settle in, and how to provide that pastoral support. So we hope very much, I mean, we have had quite politically turbulent times over the last 2 to 3 months. We do now have a new set of ministers in place in the department. Steve Barclay has been very interested in international recruitment, and Helen Whately, who is our care minister, has worked previously in this role over COVID. So the two of them are very familiar with the challenges of facing the care sector. And they really are committed to helping. Good working, well-staffed care sector is absolutely essential. We don't want to be too specific about how this funding is used, and we want local areas to agree what the priorities are in that area, and there should be good engagement of providers in the patch through the care alliances or whatever other structures are in place in that patch. Finally, just want to say a few words about the duty of care as a sponsor and the importance of good pastoral support, because this really can be sort of make or break. From talking to providers across the country, we have identified the following sort of issues as ones that providers should take seriously and consider. Providing recruits with a good information pack before they arrive, setting out what it is they might need to bring, what clothing they need, what equipment they need, goes down sort of very well. I think making use of Teams and WhatsApp and virtual methods of communication between existing and new members of staff, ideally ahead of arrival, is something that can help people feel more confident about making the journey. I think if we place ourselves in the shoes of international recruits, it sort of helps to think about what it is you'd like to know and be given advice about before you arrive. Meeting and greeting people at the airport, again, is something that creates a really great sort of first impression. We've heard of employers who've provided welcome packs to their new recruits with groceries and bedding. I don't think these need to be very expensive, but they can really make a difference to the recruit and how they feel about the employer. Local guides can be helpful. Most local authorities will have really thought this through, particularly in relation to Ukrainian refugees or other refugees that might be coming into the area. Local universities similarly may have materials that are helpful to draw on or to borrow. Recruits will want help applying for a national insurance number and a bank account. Local tours might be provided, help with accommodation. We've heard of buddying schemes being set up between local staff and new overseas recruits, and also recruits put in touch with other international recruits who have maybe been through the same experience, and actually providing information about local community networks is also cited.
Tabitha,
finally,
just before, is this your final slide? Sorry.
It is my final slide, yes, and I'm going to wrap up now. We are going to supplement the guidance that is currently available through developing some national resources, working with Skills for Care and with the Care Provider Alliance, and we hope that that will give a further boost to international recruits, to employers as they navigate this system. So thank you very much. I hope some of that has been interesting and helpful to you, and I encourage you to look at the Skills for Care website and also the National Care Forum website to find further information and guidance that you'll find helpful.